Now we are going to start immunological blood transfusion reactions. Why the people need blood transfusion? It is needed for the variety of reasons, primarily due to blood loss and blood disorder. Common situations include the major surgery, severe trauma from the accidents, complication during childbirth, and the certain medical conditions like anemia, sickle cell disease, or thalassemia. Additionally, some cancer patients and individuals undergoing organ transplant may require transfusions. But during that transfusion, there may be blood transfusion reaction occurs. When the recipient immune system react to the transfused blood typically due to blood type incompatibility or presence of antibodies against the component of donor blood. So first we are going to our first type, that is allergic anaphylactic reaction. The allergic anaphylactic reaction, the type 1 hypersensitivity against the plasma protein that is transfused. Right. It is a type 1 hypersensitivity, and you know the type 1 hypersensitivity is occur within the minutes or maximum 2 to 3 hours due to release of preformed inflammatory mediators in degranulating mast cells. And the most common allergen due to an anaphylactic or allergic reaction happening in the blood transfusion is due to IgA. So IgA-deficient individuals should receive the blood product without IgA, because IgA is the very most common allergen that causes these type of reactions. And the clinical presentations are pruritus, urticaria, anaphylactic eye wheezing, hypotension, respiratory arrest, and a shock. And if you guys focus on this diagram, the donor blood having the plasma protein including IgA that will going and combine with that, and there will be anti-IgA receptors, and that will be make the degranulation of mast cells and histamine and tryptase will be less. Now we are going to study about acute hemolytic transfusion. It is a type 2 hypersensitivity reaction, and it's most commonly called intravascular hemolysis due to ABO blood group incompatibility. It may cause a EV extravascular hemolysis due to host antibody against donor RBCs. And it happened during the transfusion within the 24 hours due to preformed antibodies. And presentation include the fever, hypertension, tachypnea, tachycardia, flank pain, hemoglobinuria. That if it will be intravascular hemolysis, if the extravascular hemolysis, then there will be jaundice. Like they're having the RBCs, the donor RBC with the A and the B antigens, and there is a host anti-A or anti-B antibodies are there. They will be caustic and through the destruction of RBC, and that will cause hemoglobinuria or jaundice. Now we are going to the febrile non-hemolytic transfusion reaction. It is type 2 hypersensitivity reaction having host antibodies that will act against the donor HLAs and WBCs. In this, there will be immune system going to act against the antigens present in donor RBCs, here against the plasma proteins. And in febrile non-hemolytic transfusion, it is a reaction against the donor's HLA and WBCs. And it will give the presentation of fever, headaches, chills, flushing, and more common in children. And it will be happen within the 1 to 6 hours due to preformed cytokines. And cytokine created by the donor and WBCs accumulate during the storage of blood products, and reaction prevented by induction of blood products. Same like that in allergic and anaphylactic reaction, we are giving the blood product without IgA. Same like that for the febrile non-hemolytic transfusion reaction, we are going to do reduction of blood products. The second, we are going to do the transfusion-related lung injury. You are giving a blood, case of blood transfusion happening in the one patient, and suddenly you get roar type, crackers type voice in the lungs during the auscultation, then it will be happening. It is maybe due to ARDS, acute respiratory distress, non-cardiogenic pulmonary edema, and due to the blood transfusion. If it happened to a donor antibody against the host, what is going to happen? There is donor anti-leukocyte antibodies. In Febrile, there was antibody against HLA and WZ, but in transfusion related acute lung injury, we having donor anti-leukocyte antibody that will go and attack on host neutrophils and endothelial cells. This will cause the respiratory distress and non-cardiogenic pulmonary edema. There are two hit mechanisms. One is neutrophils are sculptured and primed in the pulmonary vascula due to the recipient these factors. For the escaping mechanism, the neutrophils go into the lungs to protect themselves from the anti-leukocyte antibody. And neutrophils are activated by the product like anti-leukocyte antibody in the transfused blood and release inflammatory mediators that will increase the capillary permeability and cause a pulmonary edema. It is also happening within minutes to 6 hours. Now we are going to our next type, that is delayed hemolytic transfusion reaction. It's an onset over the 24 hours because it's a delayed hemolytic transfusion and maybe sometimes clinically silent, having a mild fever and hypobilirubemia. And it's a generally self-limited because it is an anamnestic response of foreign antigen on the donor RBCs like RHD or other minor blood groups, and previously encountered by recipient typically cause extravascular hemolysis. And it's happening like if there's any preformed, any antibodies are present to against any antigen that is already experienced by in the host body, then it will be occur. And it will cause in the extravascular hemolysis. What the main difference between the extravascular and intravascular hemolysis? Basically, there is a difference between the location. Extravascular hemolysis happens primarily in spleen and liver, where macrophages engulf and destroy old or damaged red blood cells. Intravascular hemolysis, on the other hand, involves the destruction of red blood cells directly in blood vessels. It's all about immunological blood transfusion reaction, but don't forget, in allergic and anaphylactic reaction, the most commonly we are giving the blood without IgA in IgA-deficient individuals. In acute hemolytic transfusion reactions, there is intravascular hemolysis typically due to ABO incompatibility. In febrile non-hemolytic transfusion, there will be antibody against the HLA and WBCs of host. In transfusion-related acute injury, there is a donor leukocyte antibody that will attack on host neutrophils and endothelial cells. And in delayed hemolytic transfusion reaction, there is a response to foreign antigen on donor RBCs.